Hello students, today we will have lecture on immunity. What are the points? Definition, types, it is innate or acquired, and then different types like adaptive, local and herd immunity. So first we will see definition. So it is defined as resistance offered by host against microorganisms or any foreign substances. Then what are the types? So it is divided into two types mainly, innate and acquired. So innate immunity or native immunity, it is the resistance by virtue of genetic and constitutional makeup. So it is present since birth. And then again it is divided into two types, the non-specific and specific. And acquired immunity, it is also called as adaptive immunity. So it is a resistance acquired during the lifetime. It is different from the inborn. And then it is again divided into two types, that is active and passive immunity. Then we will see difference between innate and acquired immunity. So innate immunity, it is present since birth, microbial exposure not required, it acts immediately, no memory present, and mechanism can be barriers like anatomical barrier, physiological barriers, or secretory products in the body and normal resident flora which protect from the pathogenic organisms. And it is divided into two types, specific and non-specific immunity. Then acquired immunity, it is acquired during course of life, microbial exposure is required, it does not act immediately, it takes some time to act to form the antibodies, and then memory is present for the second or subsequent infection, and mechanism is of by T cells or B cells, and it is divided into two types mainly, active and passive, and each is divided into natural and artificial. So now what are the components of innate immunity? This we will see in detail. So anatomical barriers, physiological barriers, then resident flora, phagocytes, natural killer cells and complements present in blood. And the components of the acquired immunity, they are T cells, B cells and complements. So now this we already saw, types of immunity. Innate immunity is non-specific, and then it is divided into species, racial and individual, and again specific immunity, it is divided into species, racial and individual. Hello students, today we will have lecture on immunity. The mechanism of immunity, innate immunity, so this is first line defense. So examples are, first is anatomical barrier, so skin, mucosa. So skin, intact skin and mucosa prevent entry of microorganisms. The sebum present in skin, it is antimicrobial. Then mucosa prevent entry of microorganisms. Mucus, cilia, they are present in that mucosa, propel microbes outside. Example, cilia in respiratory tract. Then coughing, sneezing and urine flush, these all mechanisms, they remove bacteria. Then secretory products, they inhibit growth of microorganisms. So few examples are there. So in saliva it is lysozyme, in tears it is lysozyme, in gastric juice it is HCl, trypsin and protein digesting enzymes are present in intestinal juice. Then bile salts, they rupture the bacterial cell membrane and then thus cause the killing of the microorganisms. Then lactoferrin bind to the iron and inhibit bacteria. Spermine inhibit bacteria in semen. Sebum contains chemical toxin to kill the bacteria. Then physiological barrier, so temperature which inhibit growth of the bacteria. Low pH, that is gastric acidity, inhibit growth of bacteria. So here you can see examples of non-specific defenses. So mucous membrane are physical barriers to microbes. Lysozymes present in tear and saliva. Then mucus coated hairs in the nose trap inhaled particles. Mucosa of the upper respiratory tract is ciliated, and that cilia in trachea help moving out the bacteria away from the lower respiratory passage. Flushing mechanisms like coughing, sneezing, lacrimation, salivation, peristalsis, urination, so they all help to flush out the microorganisms. Then gastric, so that hydrochloric acid neutralizes Helicobacter pylori neutralizes acidic patient. That is why Helicobacter H. pylori grow in stomach. So blood complements iron binding proteins like lactoferrin, transferrin. So they all inhibit growth of microorganisms. Lysozyme enzyme that degrades peptidoglycans. So gram positive bacteria are more susceptible than gram negative bacteria. Then phagocytes like macrophages are chief phagocytic cells. Free macrophages wander throughout a region in search of cellular debris. Then Kupffer cells present in liver and microglia present in brain are fixed macrophages. Neutrophils phagocytic when encountering infectious material. Eosinophils are weakly phagocytic against parasitic worms. Mast cells bind and ingest a wide range of bacteria. So these all types of phagocytes, they inhibit or kill microbes. Then now we will see acquired immunity. So acquired immunity is divided into naturally acquired and artificially acquired. And naturally acquired is again divided into active and passive. So we'll see example of active and passive. So active antigens enter the body naturally. Body produces antibodies and specialized lymphocytes. In passive, antibodies pass from mother to fetus via placenta or to infant in mother's milk. Artificially acquired active antigens are introduced in vaccines. Body produces antibodies and specialized lymphocytes. And in passive, preformed antibodies in immune system, in immune serum introduced into body by injection. So now we'll see comparison of active and passive immunity. So active is produced actively by host immune system. So host participation is required in active immunity induced by immunogen or infection. It is durable and effective protection is there, and immunity effective only after a lag period. So some period is required to build up the immunity, that is production of antibodies. So that is called lag period. In passive immunity, it is received passively, so host participation is not required. Then it is in ready-made or form, it is transferred. It is transient and less effective, and immediate immunity, in that lag period is not there because it is a ready-made form. So in active immunity, immunological memory present, booster effect on subsequent dose is present. The negative phase may occur because of the previous antibodies and then not applicable in the immunodeficient persons. In passive immunity, there is no memory, subsequent dose less effective, but no negative phase and applicable in the immunodeficient people. Then mechanism of immunity. So in acquired or adaptive, there is third line of defense. Then we'll see types of acquired immunity. So that we already saw. Acquired immunity is resistance acquired during the lifetime. It is of two types, active, and then active is again of two types, natural and artificial. So example of natural immunity is following natural microbial infection, and artificial is because of the vaccines. And then passive, it is again divided into natural and artificial. So natural example is immunity transferred from mother to fetus, and artificial through the immunoglobulins or ready-made antiserans. Then naturally acquired, it is clinical or subclinical infections. We already saw response to a bacterial or viral infection. Example, chickenpox, smallpox. Artificial acquired active immunity, response to a vaccine of dead or attenuated pathogens. Immunity is provided by the vaccination. Now we'll see few vaccines. So vaccines are preparations of live or killed microorganisms or their products. So there are bacterial or viral vaccines. So and there are different types. So live vaccine, example of bacterial is BCG and viral OPV. Killed vaccine, example in bacterial is cholera, and in viral it is Salk, that is for the polio. Then subunit vaccine, it is typhi VI in bacterial, and viral hepatitis B. Then toxoid, it can be tetanus in bacterial. So now what are the components of innate immunity? This we'll see in detail. So anatomical barriers, physiological barriers, then resident flora, phagocytes, natural killer cells, and complements present in blood. And the components of the acquired immunity, they are T cells, B cells, and complements. Passive immunity. So, passive immunity, when ready-made antibodies are transferred to a recipient, the recipient's immune system plays no part. It is called passive. It is a only transfer of the antibodies or immunoglobulins. Then it is of two types, natural and artificial. So, in naturally acquired from mother to fetus via placenta, or the examples are breast milk, so it contains IgA and monocytes. Colostrum, it contains bifidus factors, antibodies that protect newborn from the gastrointestinal infections. Then IgG, a type of antibody that is transplacental and protects infant up to 3 months. Then artificially acquired from the injection of serum such as gamma globulin. The method of collecting an IgG from an infected immune person and transferring this immunity to an unprotected person, sometimes given to infants who are not producing enough antibodies. Example, ATS and ADS, that is anti-tetanus serum or anti-diphtheric serum. Next type of immunity is adoptive immunity. A special type of immunization is the injection of immunologically competent lymphocytes. This is known as adoptive immunity and does not have general application. Instead of whole lymphocyte, an extract of immunologically competent lymphocytes, it is called as transfer factor, can be used. This has been attempted in the treatment of certain types of diseases, example lepromatous leprosy. Then other types, local immunity, immune response at mucosal surface. Example, intestinal, respiratory or genitourinary mucosa, and it is of IgA antibody type. Herd immunity, it is overall immunity of community to pathogen. It prevents epidemic diseases. An example of herd immunity is following vaccination. So smallpox is eradicated because of the smallpox vaccination, because of the herd immunity. And then it can be example is DPT, MMR vaccines.
These are my references. I think you can study from these references, and I hope you find this session useful. Thank you.